Welcome to familydoctor.expert. I'm Grant Blashki, and today I'm going to talk about something slightly different, what we call the 7 masquerades of medicine. And what these are a bunch of conditions that many of us as doctors forget to check. And when we have patients where we just can't work out what's going on with them, we fall back on these 7 masquerades and double check them. They were put together by one of my great mentors, Professor John MURTAGH, who's arguably one of the top GP educators in the world. And he taught me them when I was a medical student, and we'll get to them. So why are we talking about this? Well, in general practice, contrary to popular belief, very often we don't know exactly what is wrong with the person. So they come in, symptoms present very early, often at an undifferentiated state. It means that the full condition hasn't appeared, and they can be very non-specific signs. People come in with vague headaches or tummy pains or tiredness, or even just some minor mental health symptoms. And very often we don't know what's wrong. There's a terrific saying in medicine which I like to say to my students, and again I've heard John MURTAGH say this, but I don't know where it started. More in medicine is missed by not looking than not knowing. So I'm hopeful that if you've got this little list in your hand, that if you're not getting better from whatever it is, you can go along to the GP and be really annoying and say, I've watched Family Doctor Expert and I wonder if we could check these things. So what are the 7 masquerades? Well, the first thing you should always check is to make sure that you don't have diabetes. There's about 50% of people have got high sugars and they're not even aware of it. Very simple for your doctor to check. They can do a little finger prick on your finger, or you can have a proper blood test and see if you've got high sugar. The second one that I see a lot in general practice is medications. So if you have a look at most medications, even an aspirin or a Panadol, you will see pages and pages of side effects. And all medications are a risk and benefit ratio, and they do have risks and they do have side effects. Anything from rashes to tiredness to aches and pains. So get your doctor to have a good look at your medicines and make sure that they're not causing the problem. The next big masquerade, thyroid hormone. So there's another Family Doctor Expert video all about thyroid problems, but it's a hormone produced by a gland in your neck that's like the thermostat of your body. And every year I see 3 or 4 people that have had abnormal thyroid hormone undiagnosed. I've diagnosed 2 already this year. And people have various symptoms, from tiredness to weight gain to weight loss, to thinking they're going crazy. So make sure your doctor's checked your thyroid. The next big masquerade are spinal problems, particularly pain syndromes. And don't forget, your spinal cord is coming down through your vertebra, and we're not a great design, us human beings, since we evolved to be upright. There's enormous pressure on our spinal cords and on the nerves, and so very often we'll see people with unexplained pains, and it's actually coming from pressure on a nerve in their neck or their back, or even down in the sacrum. So make sure your doctor's thought of spinal issues. The other joker in the pack are urinary tract infections. And urinary tract infections are very important to check for, particularly in some older people. They won't necessarily have urine symptoms. And again, every year, just last week, I picked up a urine infection in a little old lady who was a bit confused and a bit tired, and we checked the urine. Your doctor can actually do a dipstick test where they can check it right there when you go in, or they can send off a urine for a more detailed assessment. Now, the 6th masquerade that's very easy to forget. In fact, I'll tell you a little secret. I've just dropped this video in because I forgot it when I was making the video. Sorry about that. But the 6th one to remember are the connective tissue diseases. What do we mean by that? Connective tissue is to do with skin and joints. And there's a whole bunch of diseases, things like rheumatoid arthritis, lupus, scleroderma, that can affect the body and take a while to appear. I've got one patient where no one was quite sure what was going on with her and she ended up having lupus. So ask your doctor to check all the rheumatological or connective tissue problems. So the seventh masquerade to think of is depression. As many of those who know me, I talk a lot about mental health issues and depression. Sometimes people are well aware of it, but sometimes they're not aware what's going on, and mental health issues and stresses can be another cause of physical symptoms, which is a whole big discussion in itself. So, as usual, I hope that this information is useful, and I really encourage you to go to your GP. The information presented is not supposed to replace a GP consultation, and I always recommend that you go and get it double checked and don't make any decisions just based on this video. Another little rule of thumb I'll just throw in before we finish is that I think if you go along to your doctor for 3 visits and they still don't know what's going on, you really should ask to be referred and get a specialist to have a look at you. So, or even another GP just to look at it with fresh eyes. So anyway, I hope that's all helpful. All the best from familydoctor.expert.